Hey everyone, my name is Dr. Amir Moarefi. We're really excited to be here today for Eyes on Eye Care Educational Summit. I'm here with my amazing colleagues, Dr. Sima Tabanfar and Dr. Tiffany Tseng. I am the owner and medical director of LA Sight and Cornea Eye Institute in Los Angeles, California. I'm fellowship trained in anterior segmented refractive surgery, specializing in laser vision correction. And we're really excited today to speak to everybody about updates and advantages of the SMILE procedure. We'll get started here right now, just quickly talking about how Smile has been growing around the world. And even updated from this slide, most recent information coming in is that there's been more than 12 million eyes treated across a variety of different countries. And this is just continuing to grow exponentially every year, especially with the advent of the VisuMax 800, which is gaining a lot of popularity as well. And this is kind of what we've been seeing, especially since the FDA approval of Smile in the United States in 2016. We've been seeing the numbers grow kind of exponentially, and not just in the country, but also personally in our practice. Our familiarity and comfort and the utilization of this procedure with the great results has shown tremendous growth, which I'll get into in just a second. But this is what I'm talking about, 200% growth in the last 10 years. This has been the biggest thing to come out in laser vision correction since LASIK came out after PRK. So we're really excited about this, and we're really proud to be one of the practices in Los Angeles that's offering this and providing high level care when it comes to utilizing the SMILE procedure. And when you look across even the Asian Pacific, you can see that 80% of the global smiles being performed there, and the volume of smile procedures being done comparatively over the LASIK flaps is significantly higher. And that's the trend that we've been noticing. And in my opinion, the future of refractive surgery is shifting towards a lenticular extraction versus flap creation for a variety of reasons, which we'll all get into today. And when we look at our own practice, it's just been that same kind of upward trend. At some point, we weren't doing any smile, and then as the comfort level kept growing, as the confidence grew, and as we saw the results and how we saw our patients respond not only with their vision but their post-operative outcomes and their comfort, now we're at a point where we're doing more smile than we are LASIK. And so, it is our preferred method for laser vision correction. And we're currently doing around 60% of our cases with the smile procedure. And now I'm going to pass it over to Dr. Tiffany Tseng. She's one of my amazing optometrists, and she'll kind of talk about why we prefer smile over LASIK.
Hi, I'm Dr. Tiffany Tseng. Thanks for joining us this evening. And I really want to talk about how Smile has quickly become the preferred method here at our practice. First and foremost, it is just a much less invasive procedure. A smaller incision, only about 2 to 4 millimeters compared to a flap creation. This therefore preserves a lot more of our corneal strength and minimizes any of the complications we might see. This, just in general, leads to a much faster recovery and comfort, less dryness for the patient, a quicker nerve healing, and overall a smoother post-op comfort level will just continue to enhance our patient recovery process. Also, for any patients that might be a little bit more risk averse as far as having a flap, whether they be athletes or people who live an active lifestyle, or just in general worried about potentially rubbing their eyes, causing the flap to dislodge or shift. Smile results in a much easier process and reassures them that without a flap, they can still enjoy vision correction. So let's get into more of the specifics. With Smile, we use a femtosecond laser to create 4 key planes, and you can see that right over here in this diagram. We have the posterior cut, which is a lenticular cut. We have the cap cut anterior side and the 2 small incisions on the side. This allows for a very small refractive lenticule to be easily taken out right from this 2 to 4 millimeter cap opening incision. If you would like to watch this quick video, we can see here. First, the posterior cut, now followed by the anterior cut. And you can and the 2 side cuts, all in about 7 seconds there. All right, so what goes into our treatment planning for SMILE? First and foremost, dry refraction and a wet refraction are integral, and that is usually performed at that 12 millimeter vertex distance. A lot of the stuff actually for SMILE is already predetermined and fixed, so you can look farther right over here. We have the lenticular parameters. The diameter of the lenticule is usually 6 or 6.5, and that is determined by the spherical or a toric correction there. The minimum thickness is already fixed at 15 microns as well. Now, the cap parameters is very analogous to the flap thickness. You'll see that here, right over here, the thickness is already fixed at 120 microns. And notably, the cap is about 1 millimeter larger than the lenticule. This allows for the surgeon to easily have instruments to dissect the lenticule out from the small incision on this side over here. All right, so who makes a good candidate for SMILE? Currently in the US, SMILE and SMILE Pro are indicated for prescriptions between -1 and -10, so that will make it myopia with and without astigmatism. The range for cylinder is between -0.75 and -3 diopters of SIL. To be more specific, we want to always just make sure that the spherical equivalent in any direction, any axis does not exceed -10. So what do the contraindications of SMILE though look like? A lot of it just really mirrors that of laser candidacy. So we do still want to make sure notably that the residual stromal bed thickness does not go below 250 microns. You also want to make sure that you have a clean topography and keratometry to make sure no keratoconus, irregular corneal Myers. Make sure also to get a really good patient history. You don't want patients that have any active autoimmune disease or connective tissue disease, any uncontrolled diabetes, controlled glaucoma, or anything that might cause severe dry eye or current use, such as Accutane, that might contribute to decreased recovery rates. Overall, SMILE is a fantastic procedure, but it still depends on the patient having a very healthy cornea as well as a healthy tear film as well to achieve that optimal results.
Thank you, Dr. Tseng. That was amazing. A lot of good points about why we prefer Smile. And we're just going to jump in and quickly watch a quick video. And just to kind of watch how the procedure is done, we saw quickly how quickly the lenticule was created with the Smile Pro, less than 8 seconds. Here is my case that we did in our practice. And we're just watching where we just want to make sure we center the dock on the green light in the center of the pupil. And we can see the posterior cut being made, and then followed by the anterior cap cut. So in the bottom of the screen, you'll see the incision being made somewhere between 2 to 4 millimeters. And the important thing here for people who are trying to begin using Smile is first you want to identify the incision, and you want to find that little area where the anterior cap goes beyond the posterior lenticular cut, and identify the anterior plane and then the posterior plane. I use a technique where we irrigate the instrument and then we make a little passage in the posterior plane before dissecting the anterior cut. This allows me, when I go back in there, to open up the posterior lenticular portion without there being too much tension or pulling on the lenticule to prevent any type of tearing or any type of issues, so I can remove the lenticule in one full piece, which you'll see right here. And once that lenticule comes out, it's paramount that we actually open it up and see that perfect spherical lenticule come out. I usually put a little bit of irrigation within the stromal bed just to make sure there's no, debris or any bubbles. And then once we do that, we use 2 dry Wexel sponges just to open up that lenticule. And once it looks perfect, we let it out. And then here's the other eye, the contralateral eye. Same thing. You want to have a good central dock. That oval sphere that you see, it lets you know this is an astigmatism patient, where you can see the rest of it fill there to make a perfect sphere. Then again, the anterior cap cut. What's really important is that there needs to be no movement on the posterior cut. We'll get into some complication videos in just a second. But here again, identify the incision, identify the anterior plane. Now get into that posterior, and sometimes you might have a little bit of hard time getting there. And in this case, it looks like I went posterior first, and then here I go back and I find the anterior. So there's a lot of little tricks that we can show you on how to make this really easy for you. With experience, obviously, this becomes very second nature. We identify a couple channels on the posterior cut, and then we open up that anterior plane, and this allows us to open it up and then easily dissect the posterior cut, and then that lenticule just wants to self-deliver. In just a moment, you'll see that. And there's many different ways you can, yeah, that was just a perfect lenticule delivery and very easy. I don't even have to spread it out with the Weck cells. It's already been done. So that's a really good feeling for a smile surgeon when you see it come out just like that. That's beautiful. Oh, I still checked just to be extra cautious, so that's good. And so I'm going to go through what's really important. And really, this is the part where the questions that are being asked from everybody, from the optometrists to the physicians, patients want to know, like, what are the results? What can we expect? It's a newer procedure. There comes a little bit of fear with that. There comes a little bit of, questions. How will I know? LASIK has been around for a long time. My parents got LASIK. Why should I get Smile? So let's go through some of the evidence that supports the advantages of Smile for patients and for physicians. You know, we already know Dr. Tseng already discussed the advantages. We consider it to be minimally invasive LASIK or flapless LASIK. And when we say flapless, what that really means is there's no flap complications, no microstria, macrostria, or rolled edges, or issues that patients have to worry about not touching their eyes for, weeks to months. And so the bigger ones is because that incision is so small, recovery is much more rapid. So patients can return to normal activities, which they'd normally not be able to, much quicker. And of course, the less dry eye symptoms. This really matters in patients who are prone to being dry, elder patients, people who are more prone to having issues, who have some degree of meibomian gland dysfunction, whatever it may be. This is just one less thing that they have to deal with. And of course, for all of us, especially our my optometric colleagues, when they're doing co-management and post-operative care, it's much more simple. So we're going to go through a few studies really quickly just to kind of show you there's a lot of literature out there. There's a ton talking about how there are so many advantages of lenticular extraction surgery. And, in this one in the ophthalmology journal, we could see that the main advantage of lenticular extraction over traditional refractive surgeries lies in the lack of no need for a corneal flap, which means no need for subsequent flap-related complications. This is kind of analogous to when we were doing PRK and then patients were getting haze and we had to start to use mitomycin C. Then when we did LASIK, we didn't have that incidence of haze. So that was a big step up for us. Now, well, when we had the LASIK, we have a flap now. Now we have flap problems. Now with Smile, we don't have the flap anymore. And because of the small incision, it provides better protection to the corneal nerves and maintains good corneal biomechanical properties. In this slide, it's a little bit busy, but the main thing is what we're looking at are the outcomes. And we're looking at, Smile and low energy Smile, high energy Smile. We use low energy Smile, most everyone does. And we're just looking at the outcomes. And you can see we're not trying to say visual outcomes are very different than LASIK. Visual outcomes are great with both procedures, but what we want to see for our patients, they're worried, is Smile going to be as good as LASIK? And if you look, whether you look at post-op day one on the left or post-op month one on the right, they're neck and neck. They're giving the same results. And this is exactly what we're experiencing in our office as well. So the results are very, very similar. And of course, patients want to know, most of them, especially in Southern California, we have a very active lifestyle community here. People want to get back to their normal activities, their workouts, their swimming, their surfing, and we get a significantly better and faster course of return with Smile, specifically because there's no issues with dryness, no issues with the flap. And so this kind of just talks about how people return quickly back to their activities of daily living. And the big one, there's a lot of worry about dry eyes and a lot of worries about persistent dry eyes. And for all of our risk-averse patients, if we can provide you a small incision to give you the same exact visual outcome versus a large flap, and not mitigate all that extra dryness that comes with LASIK, absolutely, as a surgeon, as a doctor, as an eye care physician, we all want to provide that. And so this is a meta-analysis that reveals that across many different parameters, SMILE demonstrates superior outcomes to femtosecond LASIK. This is a really big study in favor of the results of SMILE. And we'll get into this a little bit more in just a moment, but look at these pictures of the normal corneal nerve plexus, how it works. And in the middle, you'll see where the SMILE incision is and how that nerve plexus kind of gets damaged from the cut there. But look how much more significant it is with the femtosecond laser, making a 270-degree flap. So there's significantly better corneal nerve protection, which helps with dryness, corneal nerve sensitivity, and minimizes issues with chronic dry eyes or corneal neuralgias. And one of the things that we love to see, and with the newer technology, especially the VisuMax 800, we're seeing better higher order aberration profiles, especially with nighttime vision. These are all things that are showing that visual outcomes, not just with dryness, not just with flaps, but just vision in general, are starting to show better outcomes overall with these new advanced lasers that are coming out. And I love this one because this one is like showing that the military did a study comparing lenticular extraction versus PRK versus LASIK, and it's showing that, the outcomes of the vision are no different, and that these, in some patients, in some cases, did better than the PRK group. And so after the initial recovery period, it demonstrates comparable outcomes in efficacy, safety, and accuracy. And this is information that's super important that we can relate to our patients confidently, that SMILE is and it can go head to head with any other laser vision procedure, and if not, be better than the rest of them. So this is something that we've been really fortunate to experience in our practice, and it is something that, in my opinion, is the future of refractive surgery. And simple post-operative care. Dr. Tabanfar is going to get into it in just a second. But no flap, that means no flap complications. No, it's not necessary to have a post-op day one visit, although many still do, which is totally fine. But in some cases, if you needed to, you could do it week one. And less post-operative complications means an easier, happier patient. And now I'll pass it on to Dr. Sima Tabanfar. She is our clinic director. She is one of the most important people on our staff, and she's been very helpful for making SMILE become such a strong part of our practice. And I'll let her take over this next portion.
Hello, everyone. I'm Dr. Sima Tabanfar, and I am excited to share our experience with SMILE and the postoperative care with SMILE. As I mentioned before by Dr. Moarefi, SMILE postoperative regimen is fairly similar to LASIK. It mirrors LASIK in many aspects as far as the medications that are involved. We usually like to prescribe antibiotics and anti-inflammatories preventatively. It's used 4 times a day for 1 week for majority of the cases. Sometimes if the prescription is a little higher, then we might want to opt into a second week of anti-inflammatory to help patients feel more comfortable with if they experience or if they have any light sensitivity, it helps them ease through normal everyday activities. Even though SMILE does not have dry eyes as much as LASIK, we still like our patients to be on lubricating drops. Typically, we want them to be using the drops on 4 times a day basis in the beginning, and usually somewhere on week 1 to 2, we end up seeing that patients might end up using them less, or even feel like, well, I don't feel like I need to use the drops and my vision is consistent, and we tend to allow them to use the drops as needed. And the best part is the ease of being able to return to normal life, normal activity, and to our world. We consider when patients can go back without to work and normal activities without thinking too much about their eyes is a great experience. And it has been with smile cases. Patients often come back and say, I don't even feel like I have done procedures. And general experience that we see is that a faster and easier return back to normal activities and feeling as if they can just get up and see and enjoy what they're doing. We do recommend no contact sports or anything that involves rubbing the eyes for a week, and that's just being a bit overly cautious. Even though we don't typically see any kind of microstriae or issues with smile, we still like our patients not to really get into the habit of rubbing the eyes very aggressively. All right, now the best part. OD co-management. This is where I feel I'd like to see all of our colleagues and all of our ODs take ownership of the follow-up and the patient care. From day one, patients can go back and see their optometrist. And the best part of being the OD that is co-managing a patient is that you get to share that experience. We all look forward to one-day post-op patients. They come in, they're all excited. They can't wait to share their experience with their friends and colleagues. And it makes it easier for you as an optometrist to be able to see your patients back and enjoy those experiences as well. Often what I hear from patients on day one is that I can see way better than I did with my glasses because obviously the periphery opens up and their experience is that it's just a seamless vision. And the second thing I hear is that it was much easier than I expected. Most people are afraid of going into it, and then as soon as they come out, they always feel like, wow, it was so much easier than I imagined. And you get to hear their experience and kind of share their joy with them. Best part. Why a smile makes it easier than LASIK is, as mentioned before by Dr. Moarefi, no flap. No flap complications, no issues where you feel like, well, I don't know if the edge is a little retracted. If not, do I need to send them back to the MD? Or is the microstriae significant enough to cause vision problem? Do I need to send them back to the original doctor? And sort of these kinds of issues you don't end up seeing because, again, there's no flap involvement. I find smile patients to be easier as far as clinic flow because sometimes if there is something that prevents them from being able to come back on day one, I'm less stressed about not seeing them on one day because I'm not worried about DLKs and I'm not worried about microstriae, which are the two things that we really look for in post-operative cases. What's the vision? What does the flap look like? And the smile being obviously a flapless procedure takes that pressure off. So if it fits in better to see the patients within the first week, great, you can at your leisure. We, again, as I mentioned, we like to see our patients on day one. I like to review the drops with them. I like to make sure they have the drops with them and also guide them through, if they have any questions. As I mentioned before, we really don't see DLK with smile. It's not, it's very rare. And I personally can't remember the last time I saw a DLK, which again lends it easier for you to be able to manage the patients without having to send them back to the surgeon and worry about what's going on with them. I think and as well as the dry eye, as mentioned before, dry eye management of these patients are easier as well. Lubricating drops, yes, but we don't see as severe fluctuations in the vision in the beginning and first couple of weeks, and also patients being worried and calling the office saying, hey, I can't see what's going on. So we don't get as much of that back and forth between communication of hey, kid, is there anything that's going on? And for you to worry about seeing them frequently in the office to manage their dry eyes, it's just less office visit for them, less office visit for you, and it just becomes more of an easier process to go through. And as mentioned before, night vision and high order aberration has shown to be less with smile cases. The general recovery with smile, as this slide shows, day one, return back to work. We typically tell them they can shower and do everything they normally do on day one, driving, going back to gym, all of that. Makeup, I would say we tend to not want them to rub their eyes for the first week or so. So we tend to ask them not to do much that involves rubbing the eyes, but light makeup is fine. So just to bring the message home one more time, I like to show you the impact of SMILE versus LASIK on corneal nerve plexus. As you can see, in the normal nerve network, there's plenty of innervation on the cornea, and once comparing the diameter of SMILE lenticle versus the LASIK flap, we see how little of the area of the peripheral nerves involved with SMILE, which is actually why it lends itself to all the attributes that we've talked about as far as lessening of the dry eye issues.
Thank you so much, Dr. Tabanfar. That was amazing. And this is great. And I just want you guys to know that we're always available if anybody has any questions. We're always available if you want to reach out. We're happy to help out. Smile has been a huge practice builder for our practice, and we've built amazing relationships with ODs in the community by being one of the first to offer this technology. And we look forward to having the live Q&A and look forward to seeing everyone soon. Thank you so much.